Hi, I'm Dr. Mark with Delta Chiropractic. Today I'm going to be going over how we assess TMJ disorders. The first thing, probably the most important thing, is we take a detailed history with that patient. TMJ disorders can affect different people very differently, and we want to make sure we get a full history of what's going on. This can be examples of going over, previous dental work. Is there involvement with neck pain? Is there involvement with headaches? Is there involvement with tinnitus? A lot of different things that can be associated with the TMJ, so we want to make sure we get all of that information. The next thing we want to do is take an x-ray. We know that most TMJ dysfunction comes from a neurologic source, and we want to make sure we check the alignment of the upper neck. And so, for example, we have an x-ray up right here where we want to see when we divide the skull in half and draw a line down. We want to see, first of all, alignment in the cervical spine, especially in the first two vertebrae, but then also alignment of the jaw. And as you can see with this patient, we have some misalignment here with some rotation up at C2 and then also with the jaw. So things we want to know so we can find the best treatment for this patient with TMJ disorders. Another thing we want to look at is our heat scan. So this can help pick up inflammation side to side, assess overall nervous system tone. And this is an example of a heat scan of the entire spine, but we want to make sure with TMJ disorders, what does it look like in the upper cervical spine? The red here shows some inflammation, shows that is in a severe range of what might be going on. So it helps us put together some pieces of the puzzle of what might be going on with TMJ disorders. And the last thing we would test is different palpation. So this can be assessing a couple things. First and foremost, normal joint motion. First, we check the upper cervical spine to see how well patients either rotate or bend side to side. And this can help us assess some of the misalignments, but also how well the jaw is moving. So a big test we do is we have patients open their mouth nice and slow and then close their mouth. And so this helps us assess, hey, which joint at the TMJ, which one, whether there be pain on one side or both sides, which joint is not moving as well, and assessing the symmetry of both those joints. So all four of those things, taking a history, taking the x-ray, taking the scan, and then doing a physical exam, all four of those things are how we assess TMJ disorders at Delta Chiropractic.